Welcome everyone to our Child Abuse Prevention Speaker Series. If you would please sign in, choose your language of choice at the bottom. And if you could remember to make sure your mic is muted during the course of speaking until we split up into different rooms, or if you have a question, just raise your hand. Carmen, I'm going to ask you to come on in. Uh-oh, can we hear her?
She's joining us right now, Dora.
Okay.
Buenas tardes y bienvenidos a la reunión. Si desean escuchar esta reunión en español, abajito en su computadora o su laptop van a mirar un símbolo de un mundo. En ese mismo van a poder elegir el idioma de su preferencia. Si están en un teléfono celular o una tableta, ahí en la esquina van a ver 3 puntitos y ahí van a poder elegir el idioma de su preferencia. Muchas gracias.
Thank you, Carmen. Today, our first speaker will be talking on equity, racial disparities, and disproportionality. I would like to introduce to you Lisa Whitecrow from our DCFS office. She is the regional administrator. Sylvia, I'm going to turn this over to you.
Thank you, Darrell. Welcome, everybody. I'm so glad you could join us for our first workshop for Child Abuse Prevention Month, which is April. And we are so excited to have both Lisa and Zellery Woods here with us today. They're our good friends from DCFS. And I will introduce Lisa, and then Lisa will introduce Zellery as well. Again, thank you so much for being here. So Ms. Lisa Whitecrow. Lisa was raised in the San Fernando Valley for the majority of her childhood. She attended Cal State Northridge, where she graduated with a bachelor's degree in business administration and a master's degree in marriage, family, and child therapy. She joined the Department of Children and Family Services in 1994 as a children's social worker and immediately knew that this was the field for her. In 2000, she became a supervising children's social worker. And throughout her time in that role, she oversaw emergency response dependency investigations and continuing services, including being a training supervisor. In October 2015, Lisa was promoted to Assistant Regional Administrator in the Lancaster office, where she really developed her leadership skills. In April of 2019, she accepted an acting regional administrator position at the West Los Angeles office, and then was privileged to be appointed as the regional administrator for the Lancaster office, in November 2019. Lisa has a passion for working with people, building strong and cohesive teams, and for raising the bar for higher standards within child welfare. She has limitless energy and a strong commitment to better outcomes for children and families, especially in the Antelope Valley. Lisa lives in Santa Clarita with her husband, two sons, and animals. She is a dog and cat lover. Please help me welcome Lisa Whitecrow to our speaking series today. Thank you, Lisa.
This is so nice, humbling, and a little embarrassing, I will just have to say in all honesty. So thank you, I appreciate it. And more importantly, I appreciate being asked to join all of you today. And I wouldn't do this work and I wouldn't do this presentation if I did not have my sister in this work with me, Ms. Zellery Woods. And so while we don't have a formal bio that I'm going to be reading, let me just say that Zellery and I were assistant regional administrators together in Lancaster, and that's how I had the privilege of meeting her. We're going to keep it very real here today, everybody. So first of all, I am teleworking. I am working from home. I do have animals, and I also have a gardener out in front today. So please forgive me. And for everybody who was here last year, you'll remember that Zellery had a similar issue, but they were doing house demolition. And so there were pipes and drills and all kinds of things. So it really shows you we're real people living real lives and just wanting to serve the community. Zellery has also been with DCFS for well over 20 years, nearing, I believe, 25. She has a bachelor's degree in sociology, and like me, she's worked in many capacities within DCFS as a social worker, a supervisor, a children's services administrator, and then she joined Lancaster about 4 years ago, again as an assistant regional administrator. She is the lead manager over what we fondly refer to as ERDD, but what that stands for is Eliminating Racial Disproportionality and Disparity. And you're going to hear a lot about our work today. Because we're a smaller group and just because of the style in which Zellery and I like to talk about this, please feel free to, in whatever way on Zoom, we may raise our hands or ask a question. Hopefully you'll feel that if you have any pressing questions that you're able to have them answered today. Our intention really is to have this be a conversation, although we're going to give you a lot of information. And so I hope that that's the spirit with which you learn a little bit about the work that we're doing today. Zellery, I believe that you're behind the screen, so if you want to take over, and I'm going to pass the baton to you. Thanks.
Thank you, Lisa. Good afternoon, everyone. And as Lisa said, I'm very happy to share with you that I am not having any housework done today. So this will hopefully go smoothly and as planned. So the screen that you see today is our Invest LA, and this represents the strategic framework that was established for our department back in 2019. And this framework was authored by our former leaders, Mr. Bobby Cagle and Ginger Pryor, who are no longer with the department. However, we felt that this represents the value that we continue to uphold in the Lancaster office. Our admin team, at the beginning of every year, we have a discussion around our values and the ideas that we want to focus on. And that has not changed over the last few years. And so what we're highlighting is strengthening children, youth, and families, where we believe all children deserve a place to call home. And our families deserve access to high quality and timely service delivery with dignity and respect. It's very important to us to ensure that our staff are competent, that they're trained, and they're able to support the positive outcomes that we want for our children, families, and communities. So we do a lot of work around workforce excellence in terms of training, ongoing coaching and support in our office. Again, this is a very important value to us, as well as community and cross-sector partnerships. You know, our community, our children and families deserve highly skilled, not only highly skilled, competent, trained, and supported staff, but also they deserve to have our community come together with a shared commitment to ensure that our children are safe and our families are healthy. We want our communities to be stronger and supported where they live.
Okay, so for our goals today, we really want to share the work that we are doing around this very important topic. And this is a topic that impacts everyone. And we hope that when you walk away today, that you will have learned a little bit about what we're doing here at DCFS, that we're going to brainstorm together pathways to work forward and really work together, and that you're going to want to think about how what you do personally, professionally, can join us in what we feel is a partnership to support this very important topic, which is about eliminating racial disproportionality and disparity for African American children in our area. And I want to also mention that depending on where you may work or what brings you to the table today, the information may be slightly different, but this is an all of us issue. This is not solely a Lancaster issue or solely a DCFS issue. It's an all of us issue. All right, so Zellery is going to talk to you a little bit about the specifics of this topic.
So when we talk about ERDD, eliminating racial disproportionality and disparity, is really important that we understand the terms, right? So when we talk about disproportionality, we're speaking of the overrepresentation or underrepresentation of a racial or ethnic group compared with its percentage in the total population. And so as we go on and we talk about the data and statistics within the Lancaster office, hopefully you'll have a better understanding of what we mean when we say African-American children are overrepresented in the child welfare system. And when we talk about disparity, we're meaning unequal outcomes of one racial or ethnic group compared with outcomes for another racial or ethnic group. So this is an illustration that many of you may have seen before, but we just want to go over it again to talk about the differences between equity and equality. If you look at this, this picture, we see on the far left, well, we see number one, there are groups of people who have significant, the children, some of the children or people represented here have advantages over others. And the child on the far right not only has a height disadvantage, but this child literally, as you can see, has to dig himself from the ground to reach the starting point of the other children. When we talk about equality, equality ensures that we get the same rights, and therefore everyone receives the same successes. So we get the same resources. This is where we hear, you know, I don't see color, I'm colorblind, I treat everyone the same. And we just, you know, we fail to acknowledge that we have differences, and it's important for us to recognize those differences and address that to ensure equity for all. And as you can see, the box on the far left, the boxes are distributed to allow the child who's the shortest to be able to see over the fence. So equity speaks to ensuring that we erase disadvantages and privileges, and to make sure that we have, again, fair advantages for all. Opposite of equality, equity is created when we're able to see color, race, gender expression, and identities to dismantle systemic barriers and oppression for groups of people. Why do disproportionality and disparity exist? There are a complex array of interconnected issues. We see unequal impact of associated risk factors. There's implicit or explicit biases. In child welfare, we see that by maybe mandated reporters and caseworkers and the decisions that are made as we work with children and families. There are systemic factors such as lack of resources for families of diverse and racial ethnic backgrounds. There's the geographical context in which regional, state, and neighborhood demographics play a part. Studies show that while disparity exists nationwide, the populations impacted and the types of disparities are unique to geographical location. Then we have policy and legislation. There tends to be a lack of measures that target the needs of children of diverse ethnic backgrounds. Policies that negatively target groups of people, making them more likely to be involved with systems. And then we have structural racism, and those are historical policies and cultural dynamics that have perpetuated racism in our country throughout its existence. Then we talk about disproportionality and disparity in a larger context. We all know that there are other systems within our country where we see the same pattern. With medical care, folks of, lower socioeconomic status, people of color tend to lack access to quality care. Black mothers are more likely to die during childbirth. We tend to have lower birth weight of our babies. And most recently in the pandemic, we saw that people of color had really poor outcomes with COVID-19. We had a higher death rate. And so again, with medical care, we see this pattern. We see it in mental health with with lack of access to quality mental health care and quality service providers, having accurate diagnosis, and then criminalizing behaviors that are really associated with mental health illness. With education, again, African-American children are more likely to be suspended from school or be placed on on-campus suspension. Well, children are not in the classroom receiving that one-on-one quality education. Children of color tend to perform lower than their grade level. Again, areas of poverty, lack appropriate supplies when it comes to education for minority children. We see it in housing, and again, with law enforcement, which, over the past few years has really been highlighted. We have racial profiling and sentencing practices where Blacks receive longer sentences for crimes than their white counterparts for the same crime.
Okay, thank you. I am really going to hope, folks, that I don't have too many disturbances here. I did want to say it's hard to be able to see everyone when there's a PowerPoint, but I did want to just say hi to Sean and Keith. I noticed a few familiar names and faces, so it's really nice to see your names. I want to review this data with all of you, and I'm going to do my best to kind of walk everyone through it. I know that in a PowerPoint, when you see a lot of numbers on a screen, it can be very overwhelming. And I want everyone to be mindful that this is only one small graphic, basically, that kind of captures some information but does not tell the full story. So the first column that I want you to look at is Lancaster population. This is from the census data. And what you will notice will be information with regards to how many children between the ages of 0 to 18 live in the community. So that number column shows you that there's 34,933 children that have an identity of a Hispanic Latino background. White is 13,426, African-American 15,202, et cetera, down. So that is population of 0 to 18, not total population of all adults, seniors, et cetera. And then next to that shows you the percentage that is of 0 to 18 in the Lancaster area. And so what I want to draw your attention to is the number for the African-American children, showing at a percentage of 23.20 is the percentage, again, 0 to 18-year-olds that are African-American living in the Lancaster area. Referrals, which is the next column to the right, is the number of referrals that the Department of Children and Family Services receives and has accepted as a bona fide referral. So there might be and would be far more calls than that to the Child Protection Hotline, but it does not make it into an actual referral. A referral is basically a document that is sent to our office and that it says to us that there is an allegation of suspected child abuse or neglect that we need to go out and assess and check on this child or children. So there might be, again, there's going to be more calls than that to the Child Protection Hotline, but these are the ones that actually end up meeting the criteria to actually have an in-person contact to go check on a child. And so again, you will see the number that has been received. The time period is July of 2022 to December of 2022. And those are the referrals, okay? And so what you will notice if you look at the percentage, again, let's look at percentage to percentage, is that referrals for African-American children are nearly double that, or a little bit less than double. I will say that actually the last time I gave this very same presentation, it was a 22% population of African-American children with an exact double of 44%. So now you're seeing that 39.9% of the referrals received are on African-American children. Why is this significant and important to pay attention to? Go to the green line and let's go back to the Hispanic Latino children. So 53, basically half of the population of children 0 to 18 that live in the Lancaster area are of the Hispanic or Latino background. And the amount of referrals are a little bit less than half, okay? So what that means is it is in line with the amount of children that are of that ethnic and racial group that we are receiving calls on that become referrals. But when you look at the white population, it's lower. It means that a fifth basically of the population of children are white. But if you go to how many referrals are called in on white children that become a bona fide actual referral requiring an in-person response, it's less than the percentage of children. But when you go to the African-American column, which is the pink column, it's almost double. And so that tells you about how many more calls we're receiving, how many more allegations are being made, how many more African-American children are coming to our attention, and that someone is saying that there is a concern that's requiring us to have contact with these families. And then you'll see for the column in the goldenrod kind of shade that captures American Indian, Alaska Native, Asian Pacific Islander. It's a very, very small percentage. Once we go out and we do an investigation, we have to make a determination as to whether or not we feel that that referral is unfounded, inconclusive, or substantiated. Many different factors go into this, and the training today in this presentation is not about that. That would be a different presentation. But we have a limited amount of time, usually up to 30 days, to complete an investigation and determine whether or not, like I said, unfounded, inconclusive, or substantiated. This is now showing you the percentage of substantiated referrals, meaning there is elements of truth, or we have made a finding that it is a substantiated allegation. And therefore, this is now showing you in that middle column of those referrals, how many of them are substantiated. Almost all of those, okay, I'll restate, a large percentage of those will become an open case. If we make a determination that those allegations are true, what we're thinking about is, how are we helping this family? What are we going to do to serve the family? What do they need to be able to safely exit the child welfare system and be able to safely raise their children? So of those, in an open case, that does not mean all of the children in the open case category were removed from the home. It simply means that a case was opened. And so again, you're going to see that the percentage of open cases for Hispanic or Latino child is less than the total population that they have in our community. Same with white families, but now look at African American. And then again to Asian Pacific. And so for African American, 47.5 of those referrals end up with an open case. And now the next column is children in foster care. And so you will see that of those open cases, that is the percentage of children, again, by breakdown of racial group, end up placed out of the home of their parents. Now, even though it says children in foster care, this may end up meaning with a family member or a close family friend, somebody that they have a connection with, but it's all captured in that same category. And so again, more than double for our African American children will end up in out-of-home care, what we call out-of-home care. And then the very last column is going to tell you the bleak outcomes that come for children that enter child welfare system and end up in out-of-home care. And that's the high rate that children do not always reunify, and they end up in long-term placement or never reunifying with a parent. And so this is the percentage of children that exit foster care. I know it's a lot to take in. And I hope that by the end of today's presentation, you will understand that this really important data is why we are here today. It's to acknowledge and talk about that we have a really serious problem that exists in the child welfare system in all areas, not simply Lancaster, but obviously there is a significant rate of disproportionality in the area with which you all are here today serving, and it is never lost on us. It drives everything that we do. And so, Zellery, if you would move to the next slide, I would ask, as you sit and you ponder what I just shared with all of you, if you would enter in the chat, and it can be one word or more, how this makes you feel. What feelings are you left with after we shared this information with you? And so we'll take a pause to ask that you enter some thoughts or feelings around this. Forgive me also, I've been having this voice thing for several weeks now, and so it's coming. I'm seeing sad and hurt, angry. Frustrated, hurt, angry, disgusted, suspicious. Very fair, Doretta, if I may call you Doretta. A lot of work to be done. Sadness, and I feel alarmed. Absolutely. Scared, very scary. Yes. Thank you, Doretta. Thank you. And sadness. A lot of work. Sad that so many of our African American families are being affected. Challenged to make systemic changes. Terrified. Understandable emotions and feelings from all of you with this. Maybe actually even, maybe Zellery, I don't know if you can even just take it down for a minute, just because I feel like for me, I can't really see everybody's faces. And I don't know that you all can too. Maybe this is where we can just kind of take a moment. I think it's commonplace when you're in child welfare to feel really compelled to have to explain that our roles do not separate us out from having those exact same feelings and emotions, despite the fact that we are employed by the Department of Children and Family Services. And so for Zellery and myself and many of the staff on my team, I would say to you, that what drives us every day is every one of those emotions and feelings that you have and that we share. And that for us as a team, regardless of our backgrounds, what brought us to this work, what keeps us in this work, we have a lot of reasons why this is so important to us. And Zellery knows because, she and I have worked together for so long, and maybe Darrell and Sylvia and Stephanie might know because we've now partnered on so many things. But for many of you on this call, we're just two people that are employed by DCFS, that we are in a building and people don't always know what this means to us. Yes, Keith, and it's only one part of the system. And so I come to you as a fellow human being that is very, very concerned and cares very much about this. And our hope is that by the end, you understand that our various roles do not define our commitment to this work, and that that's what you leave with feeling. And it doesn't also mean that every outcome is shared. It doesn't mean that every decision is one that that we may not have reasons to have different perspectives on. We likely will in some situations. It means that this is an all of us issue, and you'll hear me say that over and over and over and over. And so as you think about how you own distrust, yes, absolutely. And that's understandable. And let me tell you that depending on what people's personal or professional experiences may be, that will influence that. That will really influence that. And I appreciate and kind of respect that those are people's feelings. I'm not going to sit here and say, no, trust me, takes a lot of time. Takes a lot of time. And depending on people's experiences, that may never come, or people may say, wow, I didn't really know that. And all of it is fair. All of it are fair feelings. They are fair and real feelings for each and every one of us. All right, Zellery, the next slide. And thank you all for sharing and being vulnerable to share those feelings. For some of you, you may have seen this information before. For some of you, you may not have actually seen it. And it's a lot to take in. It's a lot. Yes, there are so many factors. There are so many factors. So this slide and this quote by Frederick Douglass says, if there is no struggle, there is no progress. That's an interesting quote because many would say, well, that's easy for you to say, Lisa, who's struggle and who bears and who bears. And I'm here to say that we're committed to working on making progress, and you'll see that at the end as well. Zellery's going to talk about the next slide, but I did want to share with you, and you'll hear a little bit more about it. My background on my Zoom background is from one of the initiatives that we have been a part of for the last year and a half. And it was a Lancaster developed background that we themed from the Oz. Ironically, this Chromebook does not, there's something wrong with my Chromebook and I'm not able to change my background. I'm not able to take it off. If I go into it, it just spins. So you might say, like, what is that? And there's no place like home. You'll hear a little bit about it, but as I'm seeing some of the other backgrounds and about Child Abuse Prevention Month, I'm not able to share in joining to have a background that is a little bit more specific for this month. So I just wanted to kind of talk about that. And then Zellery's going to share with you some of our initiatives, and this one will be touched on as well.
Okay, so if you recall at the beginning of the presentation, I talked a little bit about our strategic plan. And so we are going to circle back to that a little bit and share what it is that we're doing in the Lancaster office to address our practice and just how we move about and do best practice social work in the Lancaster area, in the Lancaster office, to address these three pillars or three strategy areas. And as you can see, we call it Invest Lancaster. So that first pillar was strengthening children, family, and youth. And so back in probably late 2018, I as the lead ERDD manager, gathered a few folks who were interested in not just talking about the problem, but actually doing something. What can we implement in our office to address the overrepresentation of African-American children entering care in our office? So again, when you look at those statistics of the referrals that are called into the hotline or are investigated, found to be true, and we open a case, do these children have to enter foster care? And so we implemented the ERDD roundtables, which I will go into detail a little bit more after this slide. We also wanted to improve our faith-based collaboration. And that's just our work with faith-based organizations in the Lancaster area, developing relationships with them, partnering with them, and having conversations around how we can support families. We have our cultural broker program, which I will also go into detail about in a future slide. We also have our ERDD and fatherhood, which you may have heard of in the community. It's Father Strong. These are free father support groups and parenting classes that have been implemented not only in our office, but countywide. They are now held on Zoom, so it makes it even more convenient for fathers to join in. We did identify father engagement as one of our key areas in supporting keeping families together. I'll just say historically, we have focused our attention on the mother, but babies aren't made by themselves, and they have fathers who should absolutely be able to parent and be involved in their children's lives. And we certainly want to engage and bring our fathers in and have them be at the table and have them involved and, having even custody of their children when it is safe to do so. So we have our fatherhood program, and we also participate in community-based meetings such as this one. So we're here presenting. So again, it's about building that community support. We have,
excuse me, Zellery, before you go forward, Sean has a question. He has his hand up.
I'm sorry, I cannot see. Thank you.
I know it's hard when you're presenting. No worries. Sean?
Sorry about that. Thank you. My name is Sean Kane. I'm a district representative for Senator Scott Will, 21st Senate District that encompasses the Antelope Valley and the Santa Clarita Valleys, which is two different county DCFS offices. So what we do know is that there are foster youth who live in Antelope Valley, whose family lives in Antelope Valley, who are in foster care in the Antelope Valley, and their parents are in Antelope Valley, but their cases are out of Santa Clarita or vice versa. How are these? I assume that these are all open, but like in telling the families that these resources are available in this community, how do you reach the families who live in this community, but cases are out of another office? Is there one resource packet for everybody, or how does that work? How do the families who live here but their case is not here know that these services are available?
Zellery, you want me to take this?
Sure.
Okay, sure. That's a fantastic question. And let me also just say, based on your example, Sean, that the Antelope Valley has the highest percentage of foster youth of any area in all of LA County. And so what you do need to know, what Sean is saying is very, very relevant in that there are children that are also placed in the Antelope Valley, but their parents are not in the Antelope Valley. And so therefore their open case may be in LA, in South Central LA, or Torrance or Pomona, but the child is placed in the Antelope Valley. And so they need the resources in the Antelope Valley. So to answer your specific question, Sean, and to use that as an example, there's a couple of ways it's done. Each office does have a resource guide that is specific to the community in which it serves. So our office only has Lancaster and Antelope Valley resource guides. A social worker who has a child placed in another area should reach out or seek out from that office that serves the area that the child lives in, a resource guide if that's what they needed that was relevant to that area. Okay, so somebody in Santa Clarita could certainly reach out to us and say, if they need it, they might have on their own some of their own known resources. They might work with an agency, for example, Children's Bureau. Children's Bureau might serve multiple areas, and so they're able to say, what's the address of the child? And they're able to do a link that way. With regards to a cultural broker or some of the other services, if the case is being serviced out of Santa Clarita, again, for an example, they're able to access still resources in our local area, but it really is incumbent on the social worker to make sure that they are finding resources that are relevant to where that parent lives, and vice versa. We, the the Lancaster staff, we have children and families that live in other areas, but at one time or one parent may be in our area. That's why we have it assigned to our office. We have to do the same. We have to reach out and make sure if the child is living in Hawthorne, we're not giving them resources in the AV. We're making sure that they're connected to resources in their local community, just like they would go to school in their local community, etc. So I'm not sure if that helps. Hopefully it does. And if you know of anybody who needs some of those links, that's why we're always willing to give out our phone numbers, our email addresses. You'll see that at the end, and we're happy to help link somebody also if they need something that's localized. Cases are assigned, as Ellery kind of was touching on, but not specifically addressing this. For the most part in DCFS, cases are assigned by the mother's address at the initial stages. As time goes on, depending on various factors, it might end up being that it becomes the address of the youngest child if they're receiving permanency placement services, etc. So where a case lands may not be where it started, and the reasons that it started in a certain office may change over time as well. So if you look at a roundtable is going to be relevant for the office in which it is assigned. Faith-based collaboration, cultural broker, fatherhood, and community-based would be more geared towards where each of the respective people on that particular case or that family reside.
Thank you, Lisa. And thank you, Sean, for that question. It was a great question. So moving on to the second pillar, which is workforce excellence. In our office, we're really focused and intentional about skill building. We have internal, meaning within our office, coach developers, as well as countywide coach developers to support our supervisors and our CSW staff around best social work practice. Understanding the difference between safety versus risk. What is it that we're really worried about? Building teams of support around the family. So they meet regularly. If there isn't a regular meeting and worker is struggling or supervisor is struggling or they're stuck, we have folks that they can reach out to coach them through assessing a case. We also have Wisdom Wednesdays, that's a tongue twister, Wisdom Wednesdays, which is held once per month. And this is a training opportunity for our new hires. This is how we support our newly hired staff within their first year of just having ongoing trainings around, again, best social work practice, around internal practices in our office, how to expedite service delivery. We, meaning our ERDD team, has presented to our new hires on ERDD, sharing the numbers. What does that look like? What does practice look like? Cultural humility, cultural competency. We have our ERDD roundtables, which I'll talk about in a minute, and again, coaching support. Our third pillar is community and cross-sector partnerships. And again, what that looks like for our office is a high emphasis on father strong and father engagement. We have our prevention and aftercare agencies with Penny Lane. And again, our families, even at the referral stage, if we're not opening a case, sometimes if we're not opening a case and we are closing out an investigation, but the family requires or would benefit from ongoing support, we are able to connect them to our community agency with prevention and aftercare services. Again, our effective Black parenting courses, which are free and offered within the community. Again, our ERDD roundtables, where we have community at the table involved in the discussions around our referrals and cases. And last but not least, our faith-based collaborative. We truly believe that it is the responsibility of not only DCFS, but the community to look out for our families and to support the safety and well-being of our children. So our roundtables. Again, our roundtables, we began this process a few years ago, whereby we decided that referrals that were being investigated on African-American families, we would have a discussion with the social worker, the supervisor, our coach developer staff, community partners. We have our cultural brokers, and some of our co-located county departments, which would be like Department of Mental Health, Department of Public and Social Services. Sometimes we have our PHNs at the table if there is a significant medical issue involving a child. We also have our LA County Office of Education representative who is able to be a part if we need that person to be at the table. So we have this team of people who come together and to discuss the worries that the social worker has around a family. We also discuss what makes the situation unsafe, if it really is unsafe, or if there are just some risk factors that we can mitigate and the child is able to safely remain home with one or both parents. So it's really has been proven to be valuable to support the worker in their process, their assessment and decision making. And DCFS really wants to hear from the community. So having, if some of you know, Dr. Muhammad is usually there every week. And to lend her voice, again, we have Department of Mental Health. We have our prevention and aftercare agency there. We have Valley Oasis, who is embarking on a new initiative around domestic violence, who has been at the table and able to just lend their voice, which has been valuable with some of our interpartner violence referrals. So we have a conversation and explore all options that we can to prevent removing a child from the home. What can we do? What services can we put in place that will allow this child to remain home safely? We're able to connect the family with a cultural broker. Sometimes, cultural broker hasn't been a part of the process, and a cultural broker is able to reach out to the family, have a conversation, build some trust, and then, the worker is able to complete their assessment and possibly close out a referral. So again, the roundtables is just a forum and an opportunity for staff, our community to come together, to have a discussion about what the worker has learned so far, or even just next steps. Maybe we don't make a decision about removal or opening a case, but we're able to offer and support our CSW or social worker on next steps to move the family forward or to move their referral forward. So that is our roundtable process. Lisa, is there anything you want to add? Did I leave anything out?
No, I think other than we are continuing to try to build our cultural broker volunteers. It's a big commitment, but that's something that on an ongoing basis, we are hopeful that additional African-American members of our community would be interested in exploring and learning more. That's what I would say just about cultural brokers.
Okay. And just this slide just represents pre-COVID. We were doing this in person. We were actually coming around. It was a round table. Now we're able to do it on Zoom. So we have a weekly meeting. So these meetings are held every Thursday on Zoom. And that's how we've been able to move forward. And actually going virtual has allowed the opportunity for more people to participate on a consistent basis. So that is one of the positive things that came out of the pandemic for us with regards to our roundtable. So we talked about cultural brokers. So a little bit about our cultural broker program. It is a voluntary position. whereby folks from the community, voice a willingness to work with our African American families. Cultural brokers serve as liaisons, and they really bridge the gap between the family and DCFS. As you can imagine, sometimes, our African American families are resistant. We don't get the level of cooperation that we would like when we're trying to go in and pretty much invade their space, right? That's just what it is. We're asking all sorts of questions. We come in, we have allegations. We want to know what's going on, and they don't trust us, and that's okay. But we have our cultural brokers who are there that serve as liaisons and really work to bridge the gap with helping us communicate our concerns to the family. And they also support the family in being able to really voice to us what their strengths are, what is working well for them, who their supports are. Our cultural brokers participate, again, in the weekly roundtable. They also will support families sometimes during their court process if the family is requesting that. They also support families in our child and family team meetings. And I will also say that our cultural brokers will hold DCFS accountable. When we misstep, or if a decision is made that is questionable, they support the family in addressing those issues with us as well. And I will also say in educating us and our staff around cultural issues, around some of the traditions of the family, African American traditions, why it is, for example, that we had one recently where a referral came in and it was reported that the mom used alcohol on a baby, and that was odd. Well, in our culture, we use alcohol to bring down fevers, right? And so one of our community partners was able to expound on that and explain, well, yeah, that you may not understand, but this is within our culture, something that we do, and it's not abnormal. So our cultural brokers are very valuable to both the family and DCFS. Again, it is a volunteer position. They work at will. I also want to highlight the fact that for our ERDD program and African American families, cultural brokers must identify as African American. Uh-oh. Okay.
Okay. There's also some great conversation taking place in the chat. Etta, I saw that you had to go. If you want to get, actually, if you're still there for 1 second, I'm just going to really, really quickly put my my contact information, although it's going to be up at the end also. I just don't know if you have a chance. And then please feel free to reach out to me. I'll connect you with Ellery and we'll explain a little bit more, since you have to go. Just to let you know, it is separate than DCFS, but connected to DCFS. People do have to undergo background checks, and then they get to do training with our lead cultural broker. And so it's really important that people understand that they're not employees of DCFS, and that helps keep the separation so that people don't feel like it's, oh, you work for DCFS. They don't work for DCFS. So we can share more about that. So in hearing what you've heard today, and just part of it, what we want to really talk about, and then I do want to get Doretta, you had some great questions and what we can talk about with regards to that as well. For us, and what you've heard me say throughout, it's really about the partnership and working with others on what is an all of us issue that happens to come to the attention of DCFS when there has been a certain level of concern that has been elevated. But there are a lot of children and families that may benefit from services that are community-based, and that's why all of you are here today. And so for us, we really believe that it takes a village, it takes a team, it takes all of us. And so our our hope is that we really can reaffirm what our values are around our commitment to this matter, to this issue. DCFS has a calling to respond when there are allegations of child abuse and neglect, and those come from a myriad of places outside of us. They come from the community. They do come from mandated callers, but they also come from other people in the community that might not be mandated, but might have a legitimate concern. And even though we recognize that disproportionality exists, that we understand that bias, discrimination, racism, and other factors have contributed to this, it also does not mean that there are not children in situations that they need to be saved from. That does not mean that child abuse does not exist. It does not mean that neglect does not exist. It does not mean that there's not risky situations. It doesn't mean that there's not kids in danger right now of all backgrounds. And so we never want to lose sight of the fact that simply because we recognize that there is disproportionality and that we need to really work hard to understand it and make sure that what we're looking at is based on safety and not other factors, we have to be very mindful that together we have to have our eyes open and willing to see that there might be children that really need community-based support or even DCFS support. We remain, yes, Doretta, let's just take it to you before we go forward in this slide. Go ahead. Oh, we can't hear you. No, can anybody, I can't hear her, right?
No,
Can't
we
hear you, Doretta. It's muted. It's, if you type it in the chat, we'll read it out loud, but your microphone is muted or not up to par. So
It sounds more muffled than it is
yeah, it
muted.
sounds muffled. It sounds muffled.
So there was a question, but what was just written in the chat prior to that was color of language and cultural norms within these systems have contributed greatly as well. Absolutely, absolutely. And when we have our roundtables, and as I was sharing on a call yesterday, Darrell, for example, has been able to observe and participate on an occasion. Sylvia has also, which is really a window to what we do. We talk about all those things. And what we also talk about is what are the concerns and are there ways to mitigate or alleviate those concerns? And oftentimes there are, and oftentimes there's not. And it's when there's not that we then have to look at, well, what do we need to do? Do we have to intervene? And what does that intervention look like? So coordinated purposeful efforts, which are taking our efforts to the next level, again, are reaffirming our values, remaining focused on our commitment, and determining where there are opportunities for future growth and partnerships with others. I do also want to note the comment that Doretta put earlier, which said, how do you avoid inequities that are presented between the foster child and non-foster children who receive less advocacy? And then also she said, I'm concerned that families that have been successful, my apologies. I mean, ain't this just, it's a test. It's a test on my patience. Same thing happens every Wednesday. It's the same time, same story. Okay, Doretta said, I'm concerned that families that have been successful with avoiding these systems have less access to these services and are not prioritized the same as those cases involving foster children. With the number of unsustained cases makes this even more concerning.
This is a test of the emergency broadcast. We'll be right back with you. For all those who have animals, understand this is only a test.
We'll give her a sec.
She'll be right back.
Yes.
Woosah.
Well, this gives everyone a little bit of time to kind of absorb the information. It's a lot.
Well, and what I wanted to say is if I think about how we were connected with Best Start and a couple other providers on this call or external stakeholders as we talked, or say partners in this work, that's where community comes forward, because not every child does come to our attention. And you know what? We hope not. We hope that there's concerns that they're not recognized somewhere else. Celery, if you would take over for a second, I'm going to take care of this.
Okay, I don't know what Lisa was going to say, but I think she was just highlighting the fact that, you know, we talk about community. I think I stated earlier how much we value our community partnerships, because we all play a role in keeping children safe and families healthy. So I think there was a comment around those like unsubstantiated referrals, or those families who never come to our attention. They may not come to our attention, but they may come to the attention of some of our community partners or stakeholders, right? And so that's where you're able to intervene and provide ongoing support to these families that we may never see, because this is, you know, it's a collective effort. Okay.
Kelly, if I can add a little bit.
Sure.
In terms of our partnership here with Best Start, we also realize the importance of community voice and the experiences and wisdom that come with that. And so part of it too is who we bring to our table, right? Not just to our regional meetings or our convenings, but really anybody from our community who can be affected by this. And what we want to do is we want to bring the opportunity to learn more about the types of programs or pilot strategies that you guys are implementing, but really then give people the information and the data that is so highly important in our community, because a lot of our community may not know this, right? They may just be hearing just certain headlines or certain things that just get passed on, but it's so important for us to bring this data, this information to the community, so that you as community members, you as residents of the Antelope Valley, can also then share that and say, these are things that are happening. If we want to know more about what's happening, these are the people we can contact, or we can put you in contact with those that really know the information. So I think that's part of why the partnerships that we've established are vital.
Absolutely, Sylvia. I like what you said is, you know, we want to hear from the community what the needs are, because we don't have all the answers. DCFS does not have all the answers. And again, this is where the voice of the community is so important. The cultural broker program for our county was born from the community saying, this is what we need, right? And so, yeah, it's just valuable. And we want to hear from you all, partner with you all, and work together for the good of not only those who falls under child welfare, but the community at large.
And I think one of the things that happened too when you guys held the cultural brokerage summit or meeting you have every year to really honor those people that are taking the time to really just make an impact on the system. It was so inspiring for me, because it was a lot of people that we see as people that are leaders in the community, people that are, you know, have been around and done a lot of service to the community. But it was also interesting to find out that these people themselves had been through some of the system, have experience dealing with their own children in foster care. And it was so inspiring to hear and to see these leaders say, like, yeah, I had rough days. I had really, you know, I had distrust. I had no faith in the system. My children were taken away. And yet somehow or another, look how they are now, later on, being able to be a cultural broker, to take that family under their wing and say, I understand what you're feeling. I understand where you've been, because I've been there. This is how we're going to start taking steps to help your family.
Yeah. I believe Lisa's back with us. Lisa?
I am back. And I'm noting a question. Please review the data slide again, as the numbers and percentages are unclear to me, such as the numbers existing, is the number for exiting foster system. Kindly clarify. Besides, and number 2 is, besides the important cultural, broker, and faith-based partnerships, what has DCFS done to partner with and fund Black-owned led agencies to drive the trust, compliance, and success of families? Thank you. So before we go back to that prior slide, let me just say, so DCFS does not fund community-based agencies. We do have one contract, which it's put out for bids, and that is for our prevention and aftercare services. For SPA 1, which is the area that serves Lancaster and Palmdale, Penny Lane is the designated prevention and aftercare agency. But local agencies can serve the community, and we do have in certain situations, ways that we can assist a family. Many of the agencies also take Medi-Cal, and so they might be able to get services that way, or they can go to other agencies like Children's Bureau, Sycamores, Penny Lane, et cetera, and have community-based services and never have anything to do with DCFS. But DCFS does not fund. Partnering with, we're very open to partnering, and that's really done on a local level, I would say. I would say, for example, myself as the regional administrator for Lancaster, Zellery is one of my 7 assistant regional administrators. We have relationships and partnerships that we work on and really are just invaluable to what we do. And we call upon those people, and they call upon us, and we invite them into the work that we do to best serve our children and families. And prevention work is also part of that. So oftentimes a family will come to our attention, and we will link them, the family, with community-based services and not have any further interaction with DCFS. That may happen. Going back to that slide, it's a little bit confusing to that column, OSAS, that you are referencing. And I probably am going to suggest, if you want to email me, that I might be able to give you a little bit more. So exits to foster care is determined a number of ways, let me just say, and that has to do with when a child exits being in out-of-home care. So if a child reunifies, if a child is in legal guardianship, if a child is adopted, those are all exits from out-of-home care. And so what we look at is making sure that children achieve permanency. The most permanent option is back home with a parent or both parents. That is the most permanent option. When Zellery and I were first social workers, that wasn't the way it was spoken about. Permanency was what was achieved if you did not reunify. But now, when I'm saying now, in the last 15 years, maybe, when we talk about permanency, we recognize that the most permanent is what it says right here on my screen. There's no place like home. That's the most permanent. Home safely with your parent or parents and family. And so the goal is to have children exit out of home care. But you will still notice that the rate by which African American children are exiting foster care is still double the population that they hold, being the ages of 0 to 18 in the area in which we serve. And so there has to be significant efforts that if we get involved, which again, we've already established that there are times that we need to get involved. And if that involvement includes a child being placed away from their parent, that we work intentionally, expeditiously, in whatever ways we need to work on establishing the child getting back into the home. If that cannot happen, if that cannot, for whatever the reason is, then the goal is to make sure that the child establishes long-term connections that help them achieve permanency in another way so that they can exit foster care. And I hope that helps a little bit, but please feel free to reach out to me or Zellery after the meeting. We will get back to you if you call or send me an email. All right, Zell, let's go back to the other slide, which she's going to fast forward through it. Next one. Yeah, let's do the next one. Okay. Just to let you know how very real this topic is, Zellery and I spent a lot of time yesterday having a conversation about this slide. There were parts about this slide that the way it was written before really bothered me. And so Zellery, as any good friend would do, she said, what about it bothers you? And so we had a really robust, hearty, kind of emotional conversation around how the slide was written before. But I can comfortably sit with it a little bit better the way that we've done it for you today. So what we want you to notice is that from July 1st of 2022 through December 31st of just this very last year, 1,013 African-American children came to our attention. That means we had a referral on that many children just in that time period. Let's sit with that for a minute. Now, again, when I say come to our attention, that means there probably were even more calls than that, but that's how many ended up on a referral that met criteria that said, DCFS, you need to go and check and make sure that this child is safe. And of those children, and since the start of all of the efforts and the specific efforts that you heard Zellery talk about in one of the other slides that had the 3 columns where you saw about our roundtables and cultural brokers and Fathers Strong and community-based services that specifically work with African-American families, we are able to report that 918 of those children remained home. And I will tell you, because I don't know that it was said, I've been with DCFS a long, long time, since the 90s. And Zellery has been with DCFS a few years less than me, but for a long time, and in the 90s, that this is a shift. This is a shift. And I'll be transparent and honest with all of you that my struggle in presenting this slide and the way that it used to be written, or whoever formatted this original slide, was written in a way that said only blah, blah amount of children were removed. And I am not able to believe that, you know, I really just struggle with how it's said. Because for those children, this is their life. This is their future. This is their history. But yet we do know that children are sometimes, as we said, in unsafe situations, and sometimes we have to be involved. But I never want it to be something that, again, those decisions are not taken very seriously. We have not considered all aspects of if there are ways to safely keep them in the home. Sometimes there are not. So with all of these efforts in that last period of time that we're talking about, 918 children remained in the home.
May I offer also,
Please.
is this doesn't mean that they stayed home with mom. Kids may have primarily lived with their father. I always bring up fathers because for those of you who don't know, I'm a daddy's girl. And I have the privilege of having my father in my life. And he's 87 years old, and I have the privilege and honor of caring for him in my home, my husband and I. So some of these kids may have absolutely been removed from their mothers, but due to our father engagement, our active and intentional father engagement effort, we were able to release to a non-offending father. And that should be celebrated. So I just wanted to highlight the fact that we are very intentional when it comes to our fathers and paternal family that we are looking at them from day one. We're trying to locate them, asking where they are, how are they involved? Are you able to, take on this responsibility? Because we have to do something today, right? And so I just want to highlight the fact that what this means is that we are also actively engaging our fathers, and we have children who have been released to their care. Thank you, Lisa.
And thank you for pointing that out. Absolutely. And I would even say that the intentional work that we've done since we were here last March and we presented last March, it's totally shifted. I mean, it's really unbelievable how our commitment to fathers and commitment to talking about fathers is in every single conversation. And we, in our office, actually, one of Zellery's peers, one of the other assistant regional administrators, Vicki Alexander, she created a report that has now been approved and is now accessible to all of the DCFS offices, where we can actually track how on every single referral we ensure that we have contact, that we locate, or first I should say identify, and then locate a father, because oftentimes that information is not even included on a referral. And when we ask, if we don't have it in a system, perhaps there's never been any system involvement, and that could even be like the Department of Social Services. If there has never been any knowledge of who the father is, then we rely upon those children or the mother or extended family to tell us who's the father. So the first thing we have to do is identify, who is he? Who is he? What is his name? And do you have contact information? And if you don't, we're going to do everything in our power to find and locate and make contact with him. And guess what? His family. He's got family that are family to these children. And so that's really been a huge focus for us, and it is bearing wonderful results for these children. For these children to be able to have established contact with their fathers. So thank you, Zellery, for elevating that.
Certainly. Ready for the
Next
next slide?
So this slide is something that I had written some years ago now, and it's included in all of my presentations that I do. And it's about the main goal of eradication, and that until we achieve what I'm going to read now, our work will not stop. And I hope, well, in my time that I have left with DCFS, however many years that may be, it would be amazing. And I'm also not a fool. And I recognize all the other factors that go into this that we've talked about today, and that some of you even put in the chat. And I thank you to those that have recognized that it cannot all be on the department, because it certainly isn't. But our goal, my goal, and our goal is that all children and families will be equally represented, that every child and family will receive fair and just treatment by the systems, any system with whom they interact. And so thank you for letting me share that. So, this is just another slide about our partnership, and again, about collective impact, that the success of efforts to reduce racial disproportionality in Lancaster relies on the effective organization and coordination of existing and new assets. And so we invite all of you to lend your voice to how we can continue to address this issue in Lancaster. In the next slide, Sal. So best start, folks, do we have time, or do you think, in light of there's 29 of us, that includes Ellery and myself, would you like us to do some brief breakouts, or do you feel that a collective conversation around this would be more beneficial? And I'm really open to what everybody thinks, or what you think, Sylvia and Darrell. This would be the questions that we'd ask you in a group to talk about, which are, do you have any ideas about how this work might be furthered in Lancaster? How do you see yourself or your agency fitting into the work? Can you see yourself coming to the table to lock arms with us and join us in this commitment to eliminating racial disproportionality and disparity? And would you like more opportunities to connect with our specific Lancaster DCFS ERDD team?
I think maybe we could do 3 or 4 groups, and that way everybody has an opportunity to really share, and then we could come back and each group could present either on all the questions or maybe 1 or 2 of the questions. And then we'll make sure that we gather all this information and all these questions and get those to you in case they don't get answered.
Great.
Stephanie,
so then
can you?
maybe like 8 minutes, maybe it's 1:23, so maybe we just come back.
In 10 minutes?
Yeah, like 10 minutes. And then so Stephanie, if you can do maybe 3 breakout groups.
Oh, great. Oh.
And
And if
Zoe,
everybody could choose a person to take notes for your group, and then somebody who can come back and present a little bit on your notes as well.
So we're going to open them up right now.
Okay, thank you.
Zellery, is it possible to drop those questions in the chat box so people can refer back to them? This slide?
Okay, yes.
This question, yeah. That way they will have it.
Hi, Tess.
Hi, Tess.
Okay, she moved. And do I move you guys as well to a room?
No,
Oh, just wanted to double check.
we can stay in the main room.
Yeah, I think it might give them an opportunity to kind of like digest what they saw and what they heard, and then they can come back.
And process, yeah. Esmeralda, okay, there she
You're
is.
on back. Oh.
That was a lot of information, and it was good information. I was sitting here thinking, what can we do? And a lot of the data, like I said before, Lisa, we've been doing data maps, and a lot of the things that you even brought up, we started capturing some of it and already talking about it in our Best Start Regional meeting. As interest, that was deep, right, Sylvia?
Yeah,
So,
it's interesting.
talking about
We're really focusing a lot of domains, and we just started with the data mats in terms of housing and economy and employment. And I'll share those. We're going to be doing them like once a month, and I'll share them with you. I'll share the first 2 we have completed.
Please.
But these things did come up, and it's really interesting because Pilar, our program officer from First 5 LA, is here, and she said the exact same thing, Darrell. She said a lot of these questions were questions that were coming up as we were reviewing the data mats with our community members, and now they're taking some of that info.
Groups, and we were having a little conversation
This meeting
here.
is being recorded.
We do attend meetings where those colored charts with all of the breakdowns and the graphs will actually be all of the different offices. And so we're able to see various things. And you have some offices where the disproportionality, so every office experiences disproportionality because, again, that's a system issue. On a chart, when you see Lancasters, it will always look more because the denominator is more. And so, when I speak to some of my colleagues that oversee other offices, they may have a very, very small percentage, but it's still for each child, for each family, there is still an overrepresentation. And so some of the other offices are really just starting to develop their initiatives and their intentional efforts to address this issue. While for us, under Zellery's leadership, this has been going on for several years. And then, of course, COVID hit and some other challenges came. But the Lancaster office has some very unique challenges, and some that you all know being in this community, and then some that you might not know as time has gone on. I do hear, or I've always heard, oh, there's not enough resources in the AV. I don't know. I take a little that's a little bit of a pointer for me, because I feel like I meet so many people and so many agencies, providers, individuals, and I learn more and more about resources. I think it's a system delivery issue more than an availability issue. So it's an access issue also. So what changed? Oh, this is a great question. So Zell, do you want to take that? Doretta, your questions are fantastic. So she said, she's asking, what changed? So she's putting the question back on you, Zell. I'll let you touch on that one. And then maybe we can get back to the report out. But if you want to talk about that.
Sure. I can talk about the action. When I arrived in August of 2018, and there just wasn't a whole lot going on in terms of action to address the issue. There had been talk, there have been some people identified as quote unquote champions of the work, some folks who had attended some meetings. You know, we have these monthly meetings around ERDD. So when I came, I will share, we implemented the ERDD roundtable, what I talked about in the PowerPoint, where we meet once a week to discuss the emergency response referrals that are under investigation to explore how we can keep children home safely. So we had discussions around that, and that has been ongoing. Over time, it has grown. We've been able to have community at the table every week in an ongoing and consistent basis. We have more kind of formalized the roundtable where that didn't happen before. We've been intentional about having our workers come to present and be ready to present, where they've done what we call a record read. They come to the table familiar with the history of the family. They're able to really articulate, and if they're not, that's something we'll talk about during the roundtable, but really talk about what they're worried about. So when we have this discussion, we can address those worries and concerns, right? So we worked really hard on making it a quality roundtable process. Something else that we've implemented is we have 2 ERDD dedicated units. We have 2 ERDD supervisors and workers who have expressed interest in working with our African-American families who are sensitive to cultural components and issues that surround our family, who see families for who they are, who are able and willing to engage them. And if I can be frank, just not afraid. We actually have staff who can become intimidated with the mother who's upset because we took her kid. She should be upset, right? And so we have staff who want to do this work, and they're not all African-American workers. I want to point that out. You do not have to be Black to do this work. ERDD stands for Eliminating Racial Disproportionality and Disparity. We are building our cultural broker program. Dr. Arisha Muhammad is identified as the coordinator for both the Lancaster and Palmdale offices, but I work closely with Dr. Muhammad, and since we have come out of COVID and all of those protocols in place, we're primarily working from home and not engaging in person a whole lot. Dr. Muhammad has done a lot of recruitment. We have several pending folks from the community who are awaiting approval to move forward as being active cultural brokers. We worked really hard to establish faith-based partnerships for the Lancaster office. We really, we struggle with that a little bit. I will say several of our managers do not live in the AV. And so it's been hard for me. I shouldn't say hard, it's been more challenging for me and our lead, Dominique Denny, who's the lead over our faith-based initiative, to really get out and connect with our faith-based partners, but under Lisa's fearless leadership. We are being intentional about that because we believe it's important. It is a value to us. And we know that faith is very important in the African American community, right? So we are actively working to build and establish strong partnerships with organizations, whether it's a church, whether it's a mosque, whether it's the temple, or any, faith-based organization, community partners to join in and link with us in this work. So those are some of the things that has changed since I've been in the Lancaster office. I've been very focused on action. I'm like, okay, my thing is, let's not talk about it, let's be about it. What are we gonna do? Because we can talk all day, but we have to try something. If it doesn't work, we're always tracking and adapting. Okay, well, this is not working. What can we do differently? How can we make it better? And so that's kind of it in a nutshell. If I missed anything, Lisa, jump in. But
I'm going to, Doretta's ready to sign up. So we're going to absolutely be in touch with you after. And let me just say something, and Zellery did touch upon it. Now in my role, there are 7 in Zellery's role. So there are 7 of assistant regional administrators in the office. And then it's a little bit of like a triangle. And under that, we have supervisors and social workers and clerical support staff. Again, Zellery, I feel like I'm going to need to add a slide. Like, this is an us issue. And this is not a Black issue. This is an all of us issue. And that is messaged in everything we do. And it's not just messaged, it's owned. It's who we are as a team in Lancaster. So there isn't a social worker, anybody that we partner with, that you will not hear us speak about this, because that's how important it is. And there have been some times that we've had to track and adapt internally. Zellery knows I'm going to always reference this one meeting that I went to, or that I held, which is the supervisors. And I said, if I have led any of you to believe that this falls on those 2 ERDD supervisors only, I apologize that that was the takeaway. Just because I have 2 units that said, I raise my hand to commit to working with a population that left otherwise to maybe how cases just get assigned randomly, would not have the same outcomes, until we can achieve internally that the outcomes are the same, regardless of who services your family, regardless of their own background, that we can have open and honest dialogues and conversations about what we all bring to the table, but we all are committed to one thing, and that's do unto others. We don't stop. And that is how we work in our office. Zellery is our lead in this, but it is all of us are committed to this. And if we are not, we will get nowhere. We will get nowhere. And we have to hold ourselves accountable, as you heard her say. And there are going to be times that we're going to get things wrong. But the reality is our heart is in the right place. And so now we have to work to put our actions to match them, because our society requires that. And we are just one part. We are just one little part. And so if you, Doretta and others, if you end up joining in this work internally, like as a cultural broker, or whether you're doing it through another community agency and our work with Best Start, you will hear this. So Sylvia and Darrell, no, they're not, this is not a meeting where they're like, oh, wow, Lisa, that's so interesting. They've heard about this from day one. It's actually what piqued their interest a couple years ago now that we've been partnering with them. And so, you can feel free to check with them and say, like, is that really what's happening? And I can assure you it is, but I think someone said at the beginning, I don't know if the person's still on the call, maybe it was Donna, I'm not sure, forgive me if I'm wrong, but it's about trust. And we're not trusted, and we understand that. So we work really hard. So anyways, I just want to say, but with 15 minutes left, we certainly want to hear the voice of all of you, and we want to know what came out of those breakout groups. So maybe, I don't know, Darrell, if you want to facilitate that part of it. ask for the reporter
Well, if
back?
you have, sure. You can come off mute if you met with a group, you have somebody that can report back. We want to hear from you. You can come off mute. You can drop it in the chat box, but we really want to hear your input and outtake. So let's see. Do we have in the Keith? Yes, Lisa. That also bridges cultural gaps.
I'm all set, and maybe I'll just kind of start before I start driving here.
Yes. Why don't you
think-
do that, Mr.
Can
Reed?
you
And
all
don't
hear
be
me?
driving.
Yes, we can hear you. Yes.
We can hear you. We can hear you. Uh-oh, where'd she go? Dorita, come back. We could hear you. She went back on mute again. Okay. She might have started driving. Is there anyone else that would like to report back from your group? Until Doretta. Keith, any insights or things you want to share with us that from the group that you were in?
Yeah, basically our group was talking about that people need more information. We like the fact of what I think Lisa brought up about understanding the difference between safety and risk factors. We were saying that although people know that these statistics exist, a lot of people don't actually know what they are. And we were saying that we think that a big part of it is people who report knowing the difference between what's a risk factor versus a safety factor and maybe receive better education on that. That brings to mind mandated reporting. We're also saying that the first point of contact may be the schools because they're the ones that normally see all the kids before anybody. And to just get more education out there, talk to each other more, work together as you are already saying, basically was the gist.
Thank you, Keith. Mr. Retta, are you back? Are you okay? I see you. I see you.
I think I can talk now. Can you guys hear me?
Yes, we can hear you.
Okay, so I agree. I think in our group, most of us had a yes to what we remembered the questions were. Would we want to sit at a round table? You know, could we get involved? So around our table, and if any of my peers that were on there find I'm misrepresenting us, please jump in. But I say that we all had a yes for the most part. I also wanted to say that I agree with the gentleman. However, coming from, you know, an educational background as well as a correctional background, just the whole systems, understanding how inundated systems are presently with trying to make these changes that we know need to be made as a community, that's where our role comes in, where some of those little missing pieces within our community-based organizations, if we can fill in those gaps to help, that will keep the schools and the other systems from becoming further overloaded and not really being able to give, you know, detailed attention to what it is that we're trying to do. So it's definitely a collaborative that has to take place. Ladies, thank you. I'm very passionate about this subject, as you know. Ms. Durrell, you already know me. I think I get in trouble in groups, but I'm just not going to stop. Ms. Valerie, thank you so much for your courage in coming because Lisa, you are a breath of fresh air. Thank you for what you've been doing. But we do know, coming from a systems background myself, it's a tough culture to break through because there's a mindset. And as long as you have individuals like Ms. Durrell, Lisa, and all the rest of the people that are on this call pushing this, then collectively we can make a lot more progress to keep this boat kind of moving right along. So count me in, and I'm going off camera because I need to drive. Thank you, ladies.
Thank you so much. We're going to look forward to hearing from you for sure. Thank you.
Thank you. Oh my goodness. So is there anyone else that would like to contribute something that stood out with you, resonated with you in your groups that you'd like to share out before we bring this to a conclusion? Anybody else? I see Osa, Gustavo.
And you know, one of the things too, Lisa and Zellery, is it took us a year to get you guys back. Just know it's going to be less time when we bring you back because I think these are conversations that are vital to our community, and it won't be just, you know, for this, we'll bring it back to our Best Start regional meetings and our convenings. So get your calendar set because you guys are coming back. I think there's a lot of interest and a lot of data that you guys bring. But more importantly, I think to have the opportunity to give the community a chance to express their voice and their wisdom is vital for this partnership to continue. So I love it, and you will be back.
Okay.
I don't even know how to type properly. We're putting our contact information in the chat as we speak, and I hit the button too soon. Thank you. It's our honor and our privilege to be able to share, and I think that if maybe we'll have a side conversation about a part 2, what we really think can be some other information that the community, meaning all of your guests today, might want to know about or understand in a different way. Conversations, Keith, around safety and risk and what that really looks like and how that's transitioned over time is a great conversation, because having the community understand that from a different lens also tells them how they can support children and families in a different way. And so we'd be
and I think we do a lot of trainings of mandated reporters for teachers or people who work in social services, but we also need a reporter in general training, I think, for the community to be part of, so that they can be aware of what to look for, what are some ideas, or how to better serve those families that they may have interest in or worry about. So I think that just gives us more goals and challenges for us to work on.
Yeah. Okay. Listen, we're coming to the conclusion, and we read a couple of comments in the chat. One was, this is a form of the village. This is our village. This is a part of our village, and we are sharing, that we're talking. That was from Mama T. She said the fact that we're sharing all of this information, coming together with different agencies and entities, this is our village, and we have to work together if we're going to see some changes. Okay, that was my transcript from Mama T. Now I'm going to share my screen. Anything else? Anybody else would like to share? Okay, I'm going to share my screen, because our next presenter for our CAPS will be Wednesday, April 26th at 12 p.m. And Shen Sheffalo will be presenting Viewing Through a New Lens, a survivor's guide. So Shen is she is our speaker and trainer for our trauma-informed masterclass. She will be doing that, as well as coming directly following the masterclass, sharing for our child abuse awareness. And she has an awesome story, and we're going to keep going with her. She's going to be busy that day. At the conclusion, we want to say thank you for joining us. For those of you who were able to stay on, thank you so much. I know you have some other things to do for the course of your day, but thank you for sharing this time with us. And we look forward to seeing you back for our second part of our child abuse prevention series on April 26th. All right, everyone, have a great day, and we will talk with you soon. Bye now.
Thank you all.
Thank you, Lisa. Thank you, Zellery.
Thank you.
Thank you, Doretta.
Thank you, Joe.
Thank you, Mother Tillman.
Thank you.